In this exercise, we're going to place two yoga blocks parallel from each other, elbow distance away, right? So we're going to be able to place both our elbows comfortably on the yoga block with our wrists hanging over the yoga block, like I'm doing here. The toes at the bottom touch each other, and from there, we're going to place our head just right on the ground. So if you want something a little bit more comfortable there on your forehead, keep that in mind and place something there. And from here, we're going to bring our shoulders back and down, not excessively, but just notice how naturally the shoulders probably hunch forward a little bit. So we're going to pull them back. The scapula is going to depress and retract. And from there, we're just going to hold that position while we breathe here. For some people who, if you know yourself, either in the standing assessment or you're just confident that you're an archer, you already kind of pull your shoulders back a lot, you can probably let them come forward and let them relax in this position. But for the majority of us, I'd say maybe 90-95%, we probably need to pull those shoulders back because those shoulders are slouched forward all day long at the office, right, doing computer work. So play around with that, pull those shoulders back, and just breathe. For some people, when we first get into this position and start pulling those shoulders back, we may feel crampiness or, maybe some like a nervy restriction there or something. That's nothing to be concerned about. Getting into this position, the ground is stopping us from arching our spine, from pushing our chest and ribs out. So it's maybe the first time in a while you've actually pulled those shoulder blades back and down by using the muscles around the shoulder blades, right? And not just something else up and down the chain. So it is possible that you may feel some interesting stimuli when you start practicing this, but it'll go away. If it gets intense, you could come out of it. But more likely than not, it's a contraction that if you just kind of breathe through it and relax, it should kind of disperse on its own. And we're breathing, inhale and exhaling slowly. And with each breath, you're trying to pull those shoulders, you're trying to get a little bit more aligned. And when I say can, I don't mean you have to actually physically do anything. The body's going to work this out on its own. For you, you're just thinking about pulling those shoulder blades down and back instead of just allowing the shoulders to come up towards the neck, right? You really want to relax those shoulder blades back. But if you do that, because you're in such a nice aligned position, the body's going to work itself out and come back into function and balance here. So don't feel like you need to do anything to get there. But it may feel awkward. It may feel awkward when you finally go into a more functional position. So you may feel like you're not aligned, even though you most likely are. So just trust the position and trust the process here. Toes are touching. Just a reminder that the heels come out to the sides as the big toes touch. We have a little over 2 minutes left. And try to get comfortable here. What's the easiest way you can pull the shoulders back and down? This position shouldn't be too hard. It shouldn't be that uncomfortable. I mean, it might be in the beginning, but find a place of calm. It shouldn't be a strenuous effort here for the 6 minutes that we're in this. It should be relatively comfortable and you should be able to be here for a while. That's the reason why this exercise is a long hold. And it may not look like much watching me or doing it yourself, but if we were to fast forward this and watch what happens to your spine and shoulders and neck. It's it's pretty amazing, you know. So the the, the entire body really gets into better function from this pretty simple exercise. And that's really kind of, you know, a message with this entire course, right? A lot of the times when we're in pain, we don't need to do much, right? We need to do a little less. We need to kind of get out of our heads and get into these types of positions that allow our bodies to figure it out, so our brain gets out of the way a little bit. Notice how I turn my head. You know, I'm on this kind of like gym rubber floor here, so it kind of got a little uncomfortable on my forehead. So it's totally okay to turn your head and lay on the side of your head if your forehead gets a little uncomfortable. So you can definitely play around with that. We have about 30 seconds left here, so we're almost there. Few more gentle breaths. Okay, that's 6 minutes. You can hang out here longer if you'd like, but we're going to get out of it for now. For this exercise, let's start with making sure the pelvis is level and in a good position. And then we're going to set a timer for 2 minutes, and we're going to start moving our pelvis into a posterior tilt where we want the glutes to engage and our low back moves flush against the ground. And then we want an anterior tilt where we arch the low back and we scoop the pelvis in the other direction. And what we want to feel here is when we go into a posterior tilt and we tuck the pelvis under, we want to feel the glutes engaging and working. And when we arch the low back and we move the pelvis into an anterior tilt, we want to feel the muscles in the hip flexors, the hip flexor muscles in the hip crease contract, right? And it may not feel that way at first, but that's okay. Stay patient and keep that intention in mind as you do this exercise. A helpful cue to get the hip flexors working is imagining like you're going to lift the legs in the air. So you're not actually lifting the legs in the air, but it's the same muscle group that would lift the legs in the air. So that's a helpful way to start feeling those hip flexors when you're going into the anterior tilt. And when you're tucking, you really want to, one thing that helped me in the beginning is really driving the low back into the ground with the use of the glutes, right? We don't want to just get there by using the lower back muscles, right? But it is helpful as a cue to get to that position. So just going back and forth, taking our time. For a lot of people, the shoulders want to get involved and the neck muscles want to get involved. So really pay attention that you're keeping the upper body, especially the shoulders and neck, relaxed throughout this exercise. So this is a great exercise to do every single day. To start this exercise, make sure that the toes are touching each other as well as the heels. From there, we're going to bring our hips into external rotation, into what looks like a butterfly position laying down, and we're going to hang out there. So, a few things to really make sure here in the beginning is to make sure that the pelvis isn't rotating to either direction or tilting or twisting or hiking. And we also want to make sure that both hips are getting an equal amount of range of motion. If it looks like one hip is getting more, I want you to come up a little higher. I want you to come up a little bit higher, reduce the range of motion so you can control and bring more balance to both hips, right? You don't want to get more range of motion in one. You rather just reduce the range of motion in both hips. And if that's you, if you feel like you get a lot more range on one side than the other, today, and maybe the first few times you do this exercise, you're just trying to bring balance. You're just trying to understand and bring body awareness into what does it feel like when both hips are equal and get the same amount of range of motion. Balance is more important than range of motion, right? So if that's you, again, spend a few weeks, maybe even a month, just trying to learn what balance is in external rotation, because this is a really pivotal discovery for you. Now, if that's not you, if you do feel like you have equal range of motion in both hips, maybe you've done the work already to get balance, then you could just relax and try to let the hips open up, try to get more range of motion, and not worry so much about balance. But you can always check, right? If you are somebody that in the past did have this really obvious compensation, I would just always check in just to make sure you're not getting more range of motion on the side that wants to or that has in the past. But with that in mind, we're just otherwise relaxing and breathing, letting the hips do their thing here as the upper body stays relaxed as best as possible. Making sure the feet are still touching, right? That the heels are still touching and the toes. And that may take some time, but just practice that and try to bring your awareness there every so often. We have about 10 seconds left here, so take another nice breath, and then you can slowly come out of this position. To start this exercise, make sure the toes and heels are touching each other, and try to keep that contact throughout the entire exercise. And from there, we're simply going to bring the hips together, touching the knees, or almost touching the knees, and then going into external rotation, out into that butterfly position. And we're going to be doing this for the duration of this exercise, back and forth with a nice and steady pace. One thing to pay attention to is that one hip is not getting more range of motion than the other. So just be mindful if you know that one of your hips gets more external rotation than the other, just get less range on both hips while doing this exercise to avoid going into that imbalance and training that imbalance even further. And it may be challenging to keep the feet touching throughout this exercise, but just do your best. If it comes off a little bit, that's okay. When you can remember, bring them back a little bit more. And you may notice that the bringing the knees together motion, the adduction, it may be more challenging for you than bringing the hips out. Again, that's an important discovery, right? That tells us that we may have some weakness in those inner thigh muscles. And adduction, because adduction is a pretty difficult movement pattern to test and to assess. So it's the exercises like this that will kind of show us and shed some light on whether we have a weakness there. So if you're feeling this in the inner thighs, know that you probably need some more inner thigh work. On the other hand, if going out is more challenging and you feel the lateral hip muscles or you feel some tightness or restriction, then it is the external rotators, right? And those lateral hip muscles that are restricted, either weak or maybe a little bit stiff in flexibility or range of motion. But there's things to keep in mind as you're doing this exercise. Just maintain a consistent pace here, going back and forth, observing, watching, and relaxing the upper body. Keeping the feet touching, keeping the shoulders relaxed, going back and forth. We got about 20 seconds left, and at this point whatever limitation you have will probably start coming up. And if this feels easy for you, great, then you have pretty good function here. But if not, then you know you need to work on it, and you just generally know that this is a movement that is limited for you. Okay, we're finishing up here. Good job. In this exercise, we're going to shift our feet out to a little wider than shoulder width apart, so we have a pretty wide stance here. And from there, we're going to move our hips in this type of rotational movement that I'm demonstrating here. And the outside hip, so here the right hip is going into external and the left is going to internal. And then when we go the other way, the opposite, right? The left hip now is going to external and the right's going to internal. And this is a great way to introduce active but gentle rotation in the hips. And the hip that's furthest from you, the outside hip, should be able to touch the ground. Now, it doesn't mean that's happening for you right now, but eventually, if you stay consistent, it will. The back leg, the back hip that's going into internal rotation, that's not going to touch the ground. You just want to be able to get equal range of motion in both hips. So if going into one direction is more challenging or feels more difficult than another way, than the other way, pay attention to that, right? That's an observation that could be meaningful. Not that we have to judge it or do anything about it, but we're just observing and we're seeing how imbalance or dysfunction might show up in our body. And we don't want our feet moving too much here, right? We want to keep our feet at the same, starting the same way throughout the exercise. And if you feel like they are starting to shift, just pull them back a little bit, because if the feet are moving, that they're moving in a way that avoids hip movement, right? So notice how I just kind of sat up and kept them aligned, and I don't think my feet were doing too much deviation there from being straight, but I just wanted to show you what it would look like just to check in on them. And as always with our hip workouts, with our hip exercises, the upper body stays relaxed. Notice if your shoulders are coming up to your ears, if your neck is getting tense, if your upper body is trying to get involved, just relax it and bring everything back to the hips as you gently and slowly go back and forth. It's not a race, right? We have a nice pace. We're also not trying to fight, push the door open to get more range of motion than we can. Allow that door to open up for you as you slowly go back and forth. If there's any discomfort or pain, go right before you feel that discomfort or pain. Don't go into discomfort here. So we got less than 10 seconds left here. These are the hip synchronizers, and good job on this exercise. When you're ready, pick up your left leg while balancing on your right leg, and just take note of how you're feeling today in this position. Does the right foot feel stable? Do you feel shaky? And then when you're ready, do the same thing on the other side, checking in how the left foot feels and how the left hip feel in this position.